Research has shown that 1 out of 5 adults above the age of 50 have peripheral arterial disease, and this in very many ways increases their risk for heart attack or stroke. So what is peripheral arterial disease? This is a condition whereby the arteries of the limbs, most especially the legs, are affected in such a way that there are plaques or other deposits of fats around it, affecting how they function. Say this is an artery, so there is a little bit of clogging, there's clogging all the way. Then that means this big space through which blood was supposed to pass is reduced to a very, very small one. So as a result, what happens is that there's normally numbness of the lower limbs. If there are any wounds down there, they won't heal properly because there is not enough blood getting there to bring nutrition and nice oxygen. Often when they walk or they do their activities, there's a lot of pain of the lower limbs. The legs appear shiny and there's loss of hair. And when this disease is progressive, we end up getting death of the cells down there. So there's sort of rotting of the limb that it most of the time necessitates getting amputated. So the risk factors of peripheral arterial disease is number 1, age. For patients who are at the age of above 50 are at a higher risk. Diabetic patients, obese patients, and patients with lipid problems, especially the bad cholesterol kind of problems. So depending on the severity of this peripheral arterial disease, which often is quantified or rather diagnosed by use of what we call a CT angiogram, which really is an imaging that shows at the extent to which these arteries have been affected. Depending on how bad it is, then it will inform the kind of management that comes in. Of course, very key is diet, which will be properly advised by your nutritionist. And depending on how bad the situation is, on top of good nutrition, there could be medication or even surgery to help salvage whatever it is that is left of these arteries.